So sit in a meditative, keep your eyes closed, keep your body relaxed, and generally allow the whole mind and the body to become receptive to the vibrations from the sound of Shank. Get ready to chant mantra Om 7 times. Make your sankalpa. I am chanting Om, creating a protective energy field around me that keeps me protected from all external negative influences, antibodies, and viruses. I am creating 3 layers of protection. On the outermost layer of 6 friendly creatures, an elephant behind me, a peacock in front, a tiger on my right side, a lion on my left side, an eagle above my head, and a black tortoise below me. Inside of that, I have a big ring with balls of fire. I am lighting all the balls, allowing a firewall of protection to go up all around me. Third layer of protection comes from the subtle energy of the mantra Om that I'm chanting. Take your awareness to Muladhara Chakra and the perineum 4 petal lotus, red in color. Visualize that you're balancing your tamasic and rajasic quality and you're sharpening your sattvic quality. Take a deep breath in and chant Om as Uma. Shift awareness to Swadhisthana Chakra at the spinal terminus, 6 petal lotus, orange color. Visualize that you're balancing your Ida Pingala Nadi and you're sharpening your Shushumna Nadi. Take a deep breath in and chant Uma. Shift attention to Manipura Chakra directly behind your navel, 10 petal lotus, yellow color. Increase pitch further, visualizing that you're removing blockages of energies from the Pancha Koshas. Shift attention to Anahata Chakra directly behind your heart center, 12 petal lotus, green color. Increase pitch further, visualizing that you are balancing the Pancha Tattvas. Shift your attention to Vishuddhi Chakra directly behind your throat pit, 16 petal lotus, blue color. Visualize that you are balancing the three doshas. Shift attention to Ajna Chakra, 2 petal lotus, indigo color. Increase pitch further, visualizing that you are piercing Jagrat, Swapna, Shushupti Avastha and you are entering into superconscious state. Shift attention to Sahasrara Chakra, center of the top of your head, 1000 petal lotus, white color. Increase your pitch further, visualizing that you are piercing through all blockages and impediments and merging with your Creator. Shanti mantra, Som Sahana Bhavatu, Sahanau Bhunatu, Sahaviryam Karavavahai, Tejasvinamaditamasthu, Ma Vidishavahai. Om Shanti Shanti Shanti. Hari Keep your hands in Linga Mudra. Make your sankalpa. I'm chanting Mahamrityunjay mantra for physical health and mental well-being. Chanting the mantras every day helps me maintain the best of health mentally and physically. All my brain cells and my body cells are operating optimally and in harmony with each other. I can feel your grace, my Lord, penetrating deep into my body, energizing each and every brain cell and body cell, keeping me in pristine health at all times. I bow down before you, thanking you from the bottom of my heart for keeping me in pristine health, and I promise to put in efforts from my side for keeping my body in a healthy condition, befitting for you to reside inside my body in your effulgent form. We'll chant 11 times quickly. Om Triambakam Vijamaghe Sugandhim Pushtivardanam Urvarukamiva Bandanan Mrityor Mukshiyamamritat. Om Triambakam Vijamaghe Sugandhim Pushtivardanam Urvarukamiva Bandanan Mrityor Mukshiyamamritat. Om Triambakam Vijamaghe Sugandhim Pushtivardanam उर्वारुकमिव बन्धनान् मृत्योर्मुक्षीयमामृतात् ॐ त्र्यम्बकं यजामहे सुगन्धिं पुष्टिवर्धनम् 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 उर्वारुकमिव बन्धनान् मृत्योर्मुक्षीयमामृतात् ॐ शान्ति शान्ति शान्तिः हरिः ॐ. Slowly release your mudra. Keep your fingers touching each other, the hand in the form of a ball. And then allow your chanting's vibration to penetrate deep inside your body, making each and every cell inside the brain and the body to vibrate at its harmonic original frequency, restoring total health to the entire body. Then slowly release your hands, rub them, keep them on your eyes, then gently open your eyes. Okay. Now tell me, how is it after that improvement? It is holding or there is any
it is better. The pain is better, but still see here. When I lie down on the back side, by something shavasana kind of, or by straightening the leg, some pain increases here. This pain increases. I'm not sure why specifically increases while lying down. And that pain continues next day. I mean, I'm not able to sleep on the back with the leg spread.
Okay.
So that is here specifically this area spreads till down here like this. And this thighs and all starts paining. See, from here to full thighs starts paining. And
as soon as you lie down, it starts paining or it starts after some time?
Few minutes later, after. Some 10 minutes or something like that.
And this happens even when you don't change any posture. You just lie on your back with the legs spread out, and in 10 minutes, automatically it starts paining.
Yeah, in the left side.
in the left side.
Sometimes right side starts, but not much, but left side so much, not of pain, which spreads to the thigh also.
Okay. Now, in any of your sessions with Aruna, have you gone through something called somatic experiencing?
No.
So, somatic experiencing is where you recall any traumatic instance in the past
Uh-huh.
and you allow your body to go through the same emotions that occurred at that point in time. And then from within your mind, you transform that situation in such a way that whatever was the trigger for the trauma disappears. And then you very consciously and mentally release that trauma from your subconscious once and for all. Okay, because
No,
when
actually, she did that. She did this. I have some concern that what she did was she opened up the Pandora of the emotions, the previous experience. But that after 1 hour session, that was not closed. I left in that emotions. So
oh,
that emotions caused me tremendous panic attacks, and my stomach again, during that period I had an acidity severe that came back and severe panic attacks. And I asked her, whenever we open up those emotions, we have to try to close that day. If we are not closing that day, I had to leave until next session. In that emotions, it tremendously impacted on my body. Till today, I was not able to recover my acidity and all. I mean, she said it is normal. It will happen like that. But somehow I'm so scared to go back to that emotions and then not closing down. I mean, if you are not closing, it's not really good.
it's because you see, uh, a pain that otherwise is not manifesting suddenly starts manifesting in a particular posture. Could be a combination of, I don't know whether you can recollect any particular traumatic instance which
Mhm.
triggered when you were in that lying down position.
Maybe
Anything you
possible.
can recall? No. Okay. Otherwise, if you can connect to any of the multiple traumas that you opened up and did not close or whatever,
Yeah, many of them, yeah.
yeah, any of them was so burdensome on you that that burden would have traveled down to your hip joints and the hips. Can you recall any of them?
Yes, sir. See, almost all of them are burdened experiences for me.
Okay.
Overwhelming and burdened, confusion, all those emotions. We could identify all of them during that somatic experience. But unfortunately, we were not able to, I mean, we did not close. I mean, I don't know what
Basically,
else.
somatic experiencing, the way Peter Levine recommends, is you open up and then you try to bring a twist in the whole thing in which you become uh, the driver of the whole thing, and therefore from a traumatic situation it turns into a situation of an advantage. Like for example, if you feel for a dog attacking you and you feel everything, you're running, etc., then in that same somatic experiencing we say, okay, now you are suddenly developing the courage, you're turning around and you are attacking the dog. Then whatever was the trauma of the dog attack will now go away because you are now transforming yourself into the one who becomes the attacker and not the attacked. And
Yeah.
then you feel a relief coming in and the body relaxing, all the body movements like increased heartbeat, body stooping forward, all that will reverse one by one. And then you feel comfortable and then you release the trauma from the body. That's how somatic experiencing practices are normally supposed to be done. She must be having something from her psychology perspective where you don't close it immediately, which I am not aware of.
So because of that situation, sir, it was very scary because when it opened up, I cried, 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 and that crying was there weeks after weeks. I mean, I was only thinking about those things and crying, not close. And I told ma'am, we have to close it. Otherwise, I live in that emotion and the same symptoms are again and again coming back and it's increasing. Ma'am told it is we have to hold on. I mean, it is the way it is, it will increase or something like that. Maybe that psychological side they have that I'm not sure.
So whenever I
So,
worked with the people who come to me who have not taken a counseling session, this is how we try to release the trauma. And for them, it has given results. That is why they were not in a, I mean, they were not required to go to a counselor.
no, absolutely. Actually, see, I mean, how do you do, sir? How you are doing somatic experiencing, or
Yeah.
people do themselves?
No, no, I direct them and they do the experiencing.
Okay,
Yeah, you want to experiment one today, we can do, but we take only one. We don't open up the entire gamut of problems. You
okay,
can, you can take any one of them yourself, the
okay.
most difficult one, and I'll show you. But you have to first tell me so that I know how to guide you. So you have to
Yeah.
tell me what was the traumatic experience, the worst one that you want to deal with today.
Okay. I have a lot of them, but one is specifically. Uh, See, two events I want to deal. One is when I was in 20s. So another one is from 2016 onwards. I think I was around 45, 46 years of age. The second one, which caused neck pain. Okay, so that is the traumatic event which caused neck pain.
Hmm.
Another one which caused severe acidity. So these two are the things which I had a very severe attributed.
Let us start with the one which caused you the leg pain and
Okay.
see how it
Yeah.
helped
So
yourself.
2016, what happened was, shall I tell you the story?
Yeah, yeah.
Yeah, 2016, August, I visited the US. July, I visited US. I was getting some kind of, severe palpitations and all. I did not recognize it may be anxiety or something like that. And I came back home, and one day while going to office, I suddenly got into severe panic attack. That time I was not knowing it is a panic attack. Panic attack in the sense that current kind of mood, whole body palpitation, and it kind of heart attack kind of. And I was traveling with my driver, and my husband was there. I said, I think heart attack ho raha hai. It's over. Take care of the daughter. And then they took me to nearby hospital, and hospital told I mean, hypothyroid. There is no heart related any issue. Hypothyroid. And they also did not tell me the severity of the anxiety. They did not tell anxiety. They said it's a clinical related. And then there was a person who died besides me who was also emergency heart ke liye aaya tha, he died. And after that, the incident, that panic attack, I could not make out. And doctor is telling heart is fine. And I'm extremely brave person from before the beginning. And then they said, and then I also has hypoglycemia. Sugar used to drop. A lot of these small symptoms. And then I went to another doctor and he prescribed. He said it is a thyroiditis and it will become hypothyroid. You wait. He did not administer medicine. And suddenly mind and all was ajeeb sa ho raha tha, and I was kind of sad. And suddenly I started fearing for death. Oh, my daughter is 7-year-old. What I am going to do? I mean, I don't want to die. I'm so scared and fearful. I stopped sleeping completely. I stopped sleeping, nervous. Anybody talks palpitations and repeated panic attacks. So it was happening, and I went to doctor to doctor, doctor to doctor, doctor to doctor. Every possible hospitals I visited, every possible tests I have done, and everybody told slowly. Some people told you are not dysfunctional; it is not so serious, but you have a stress. So nobody told it's an anxiety attack. You have to meet this, that, and all. And then 2016 it happened. In 2017 it went on searching, and I was so confused, overburdened, and stressful. Promotion nahi ho raha tha, office was very stressful, home chota bacha tha, and my mother-in-law was a dementia patient. She was screaming, shouting, crying, and my anxiety kept on increasing. I am almost withdrawn from the life completely. I was used to go to office, but withdrawn from the life, or did not take care of the child, did not do anything. And 2018, same way, another time I went to Germany, I got a pulmonary embolism, and that caused some more pain. And this 2016 onwards, because of this overburden, I mean, it's something like it's a feeling of the overburden, a death fear, extraordinary fear setting in such a way, neck pain started, and then shoulder pain, all these pains triggered like anything. And then slowly these pains started increasing, and fear of the pain itself started. Oh, I'm getting pain, I'm getting pain. Oh, I'm getting pain. I mean, so panic. I'm getting pain, I'm getting pain. I'm not able to go to office. I don't want to, I can't do anything. I'm not able to take care. I withdrawn from the life. I withdrawn completely. I was going to office, but completely down. Tried to do, and I kept on running, pillar to pillar. First time pulmonary embolism, again 2022, again pulmonary embolism. Every pain, and they said, okay, lifelong you have to be in the blood thinners. So the trigger of the pain is that first panic attacks. After that, I started fearing for the life. The living, I mean, I have to live. I want to live. I mean, I may die. Why I'm getting pain? Why I'm happening this? So it's something like a fear and pain cycle went into the, repeated stomach acidity, stomach problems, not able to eat anything. It's something like I went so deep in a fear cycle, never slept for 2 to 3 years. Nowadays, I sleep little bit. Now also, I have not got out of that fear cycle. My brain has set a pattern in such a way, even if you talk, it triggers the high alert, danger. So something like that, all the time my brain is in the danger state only. It triggers acidity immediately, it triggers, everything. Now also, I was not able to come out of this, but still I'm able to live now better than the previous. But neck pain, those pains are not able to got out. That brain has set that pattern so strongly that, fear of pain, fear of death, fear of, panic attacks, which was happening repeatedly. I don't know what is happening in the body, all these things actually.
Okay, so
So
let's try one round of meditation and try to release it. So sit quietly, keep your hands on your knees, spine straight.
sir, one more thing I want to add to you here.
Yeah.
There are lots of dreams because of this confusion, sir. That is, I'm not able to get the solution, pain, problems, hospital. I get dreams in such a way all the time in my dreams, old buildings, old people, confusion. I'm standing on the mid of the road, nowhere to go. And I'm all the time roaming around road to road. I'm seeing all small roads, congested roads, no way to go, always roaming around in the road. Lot of unknown people in my dream. There is no day I slept peacefully without dreams. All the time these dreams.
Okay,
It's anxiety, overwhelming.
very good. So let us try to see how much we can release. Since there are multiple things, all of them may not be released in one go, but once you experience what I'm doing, then we will know uh, as we progress as to whether it is helping, not helping, which based on feedback we will continue. So sit quietly, allow your entire body to relax completely. Relax your face, head, neck, relax your shoulders, relax your chest, abdomen, pelvis, relax the whole back, relax the glutes, thighs, knee, foreleg, and your feet. Relax both the hands and the fingers. As you are relaxing, pay attention to your breathing. When you're breathing in, observe that you're breathing in and say to yourself, I'm breathing in. When you breathe out, observe that you're breathing out and say to yourself, I'm breathing out. As you continue to do that, pay attention to your abdomen. As you breathe in, see the abdomen expand wonderfully. As you breathe out, the abdomen contracts. Gently nudge your attention to the space in front of your forehead called the Chitakash. In that space, see what is in front, it will be like a dark space. Treat it like a movie screen. Start by creating an action replay like a movie replay. Start with the instance of your trip to the US. As you are now in the US, bring back to memory the anxieties that you were going through, how you were conducting the meetings while facing the anxieties. And every time you become anxious, see what happens to your body. Recall from memory what exactly was happening. Can you sense the shoulders tighten and pull forward? Can you sense your heart beat a little faster? Can you see yourself pulling your stomach in, tucking it in and holding it tight there? Can you feel your cervical area tightening? Your head is bending forward. Bring to memory each and every small, minute aspect of what you went through in the body every time an anxiety came on. Bring yourself back to India. Bring yourself to the situations you're facing and see yourself traveling in the car with your husband and an unknown impact in your body like an attack, similar to an heart attack, tightening your vocal cords as though you're swallowing in your saliva, your entire face tightening completely. Your head is dropping down. You're almost crouching in the car. And see yourself telling your husband, it looks like it is an attack, I may not survive. Take care of the daughter. See yourself going to the hospital. See the other emergency case person dying, triggering further panic in you. See yourself being discharged, saying there is nothing wrong with your heart, but it could be a thyroid problem. See yourself meandering through in life aimlessly. Promotion is not happening. Kid is 7 years. Bring back to memory your mother-in-law in dementia, shouting, not recognizing people. You are being pulled between wanting to pay attention to the family and wanting to pay attention to your job. It's as though two different people are pulling you on two different parts and your body is being cut vertically into two sides and splitting. See the weight of this entire burden collapsing on your whole body and see the trigger of a leg pain as a consequence. And as you're going through this, now visualize yourself calling out to your Ishta Devata, saying, where have you dumped me and where are you? Why are you not around to guide me? As you say that, see a brilliant light appearing, a shimmering silvery white light enveloping you, and ensconced in that light is your Ishta Devata. And see your Ishta Devata very categorically speaking to you, telling you, my dear child, What are you getting scared about your death? Every person born on this world has an expiry date, and on that expiry, that person has to go. Whether it is a monarch, a president of a country, or an humble beggar on the street, everyone will go on the day destined for them. Nobody can save them. So you need to live with the fact that you will not be disturbed till your day. And when the day comes, in any case, you have to go. So stop worrying about your death. As your Ishta Devata says this, see a trigger of intelligence dawning on you, a realization dawning that what am I wasting my time for with unwanted fears? I cannot stop, nobody else can stop when my time comes to go, and therefore from now onwards, I'm mentally ready to leave when my time comes. As you say this to yourself, see your whole body beginning to relax. See the body straightening up, the heartbeat becoming normal, the breathing becoming slower and longer, the shoulders relaxing and going to their neutral position. They're no longer pulling forward. Your face muscles, which are tight, are relaxed. The cervical muscles, which are tight, are relaxed. Now say to yourself, this unwanted element that was triggering a trauma from within me, I am letting it go from my subconscious voluntarily. I have accepted what happened. It need not be there in the future, and therefore I am letting it go and see it remove itself from the subconscious, go out through your Agnya chakra into the atmosphere, and see your Ishta Devata catching it, and the light coming from the Ishta Devata burns it off into ashes. See your face smiling. You're now confronting your Ishta Devata, bowing down before the Ishta Devata, thanking the Ishta Devata for this release, for this awareness, for the need not to be afraid of death at any point in time, for a need never to fight what is naturally going to happen. As you bow down and offer your gratitude, see the Ishta Devata blessing you, telling you that your leg pain will no longer trouble you, your cervical pain will no longer trouble you. They're all gone away along with the trauma that you released. Now take on the challenges of the world as you face and go forth and succeed in whatever you set out to achieve. Saying that, your Ishta Devata leaves, the white light disappears, you are back to where you are, sitting in the chair, meditating. Become aware of your place where you're sitting, the room where you're sitting. Become aware of your breath. Move your head from side to side and then toggle them up and down. Nicely rub your hands, feeling yourself completely in a state of relaxation. Keep them on your eyes and then gently open your eyes and then release your hands. Very good. And now we will do some practices and let's see how that helps you.
Okay.
So,
So I
how do
wanted to ask you, sir, tell me.
you go ahead. You finish your
No,
questions.
yeah, I wanted to ask you this calf muscles in the right leg here. How to release one or two exercises, I mean, somatic movements I
Yeah,
needed to
yeah,
release this
yeah.
part.
We'll do it in the chair only. I'll just get
Okay.
a chair. Give me a minute. Yeah. Even if you cannot see my face, that is okay. It's important to see the feet.
Okay.
So, keeping the feet like this, you'll start first with the first muscle, leg, right leg. Which leg you want to first start with? Right or left?
Right leg,
Right leg.
sir, here.
Yeah, yeah,
Uh,
that's okay. So, what you will do
this
is,
calf, right side calf muscles, this side.
yeah, correct, yeah. So, what you will do is go a little behind. Yeah, correct. Yeah, yeah. You can see my leg, right?
Yeah.
Yeah. So you're going to turn the feet with the toes pointing outside. You should feel the movement of your calf muscles contracting, and then slowly lift your leg a little bit. Slowly return your leg, turn the toes back to straight. Now you'll repeat this two more times. Turn the toes outwards, lift your leg up a little bit, slowly come back, turn the toes straight again. Third round, slowly come back and then turn your toes back. Now you're going to turn the toes towards the other leg and then lift. So you're now working on the outer side of the calf muscle. Press. Slowly return. Return slow. Second round. Very good. Third round. Very good. Now you're going to keep the leg a little forward and then keeping the feet on the ground. You're going to lift the toes towards the foreleg. See the entire back of the calf muscles contracting as you do it. And very slowly take your foot back to rest on the ground. Second round, very slowly return. Third round, very slowly return. Now bring the leg back to the starting position parallel to each other. And now in this, try to take the inner edge of the foot toward the ceiling and slowly come back. Second round, slowly come back. Third round, slowly come back. Then, now you're going to take the outer edge so that the knee will move toward the other knee. Yeah. Slowly release. Very slow release. Second round, very slow release. Third round, yeah. Now you're going to Lift your heel up, the weight will roll onto your toes. Just feel that. Very slowly return. Second round. Very slowly return. Third round. And relax. Now once again you're going to move the leg a little forward, lift the toes from the floor, and then you're going to rotate your leg in a clockwise direction. Slow rotation, not fast. Last round. Now the counterclockwise. And relax. Now when you're abroad, I'll show you one more thing which you can do regularly. Whenever you're working or in a meeting, when your
Okay.
legs are under the table, you can actually do what is called the tailor's motion, the tailor pedaling the sewing machine. So you
Okay.
take the heel up, toes up, heel up, toes up. Correct. So you can do this 20-25 times whenever you get a chance, every 2 hours or so. This is very good for your calf muscles.
Okay.
And this is the calf muscle is supposed to be like a second heart. All right. Now,
Okay.
now just check your calf muscle and see if you feel any difference or it is still the same.
Somewhat better, sir. A little bit
Yeah,
better.
great. Now you'll have to lie down for the next practices to attend to the glutes. Now, if you need to keep a cushion handy, keep it.
Cushion for?
Resting your head.
Okay.
We are going to practice two practices in the side, three practices in the sideline. So you first watch.
Okay.
You are in the chair position like this, and your bottom hand is straight at the level of the shoulder. In the first move, you're going to keep your head with the eyes looking at the ceiling, and you're going to keep your hand just over your chest. And in this position, you're going to rotate the lower spine vertebrae in this direction and the upper spine vertebrae in the opposite direction. And that will open up all the vertebrae, and therefore if any of those vertebrae are pressing against each other and therefore pressing a nerve that is causing the pain, that will go away. Okay, so now you're keeping the hand like this. Simultaneously you will start lifting the both the knees up, and the hand will go down wherever it can reach. Then when you're bringing back, your hand will slide back and your knees will come back to the starting position. Okay, so this is the first move. Are you clear on this?
Yeah, yeah.
Huh?
Yes, I'm clear.
Now the second one is, you keep the hands together And in this position, the movement of the vertebrae is similar both on the lower spine and the upper spine. So you start moving the knees up, hands up, and try to go with the hand on the other side, turn the head to the other side. When you come back, you will start bringing the hand back, bring your knees back, slide the hand back. So that's the second movement. And the third movement is you're going to keep your legs straight, and keeping them like this, you're going to take the top leg as far away as you can comfortably take it, and then slowly bring your leg back to the starting position. And last, you will take it like this, bend at the knee, and then release that knee flexion and slowly bring your leg back. So I'll keep giving you instructions again, one by one.
Okay.
You lie on your side. Now the side where the pain was there, that will be on top. Are you right? Yeah. So lengthen the bottom hand straight at the shoulder. Correct. Now keep the upper hand near the opposite chest. Not like that. Near the chest, near the clavicle. Yeah, correct. Now, no. You're looking up at the ceiling, not on the other side.
Okay.
Correct. Now, when you start breathing out, you're going to lift both the knees and slide the top hand towards the other palm. Start. And when you're reversing, you will breathe in. Very slow reversal. Take your time while going back. Very good. Now in the second round, I want you to breathe in while lifting your knee up and moving the hand, and breathe out when you're coming back, and see between the two which is better. Slow reversal. Now, whichever breathing was more comfortable, use that breathing and do the practice a third time. Wonderful. Relax, catch a couple of breaths. And now you're going to bring both the hands one on top of the other. Now, in this breathing in, you will raise both the knees, slide the top hand, take it to the other side, and the head also turns to the other side. Movement is continuous, slow lifting of the knee, sliding the hand behind, hand goes all the way to the other side, your body turns, your head turns to the other side. Very good. Let it go on the floor completely. Lovely. As you reverse, breathe out and slow reversal. Very good. That was a lovely slow release. Now second round. Last round. When you come back to the starting position, you end. Perfect. When you complete, just lie on your back for a minute or two to relax. Then once again, come on your side with the same side on top. Legs are straight. And you will slide the top leg behind you. No, the hands are comfortable. You don't have to move the hands. You can keep them whichever way you want. You can keep them on top of the body or on top of each other, whatever. Only slide the top leg behind as far as it can go comfortably. And then slowly come back. Perfect. Second round. Slow return. Last round. Slow return. Now the next move, you're going to do the same, but you're going to, after you reach your limit, you're going to bend your knee. Take the leg as far as you can take, stop, bend your knee, correct. Release the knee bend, so the leg will become straight but still extended. And now bring your leg slowly back to start. Perfect. Relax. Second round. Slow return. Perfect. Last round. Now, while you're in that position, I'll ask you to do one more move before we stop for the day. Is you're keeping normally we keep the leg in this chair position. From there, you straighten the leg up a little more. There is still some bend, but it is not absolutely 90. So there is an obtuse angle here. And in that position, you will slowly raise your knee. Very slowly bring your knee back to start. After 3 rounds, you will lift your foot, slowly return. After you've done 3 rounds of that, you're going to lift the entire leg up and very slowly come back. Okay? Start. Correct. Slowly, correct. Very slow. Return even slower. Perfect. Rest the knee on top of the lovely. Relax. Second round. Slow return. Last. Slow return. Relax, catch a couple of breaths, then you will lift your top foot towards the ceiling. No. You see, you're pulling the feet towards your buttocks. That should not happen. It should go correct. Just bring it down like that. Correct. Lovely. Second round. Very nice. Last round with full awareness. Slow comeback. Very good. Now you're going to lift the whole leg up. Slow. Return very slow. Controlled return. Don't stop anywhere. It should be a continuous slow release movement. Very nice. Second round. Good control. Slow release. Last round. Then lie on your back and see how the glute area feels when you lie down. Any feedback the body is giving you, let me know about that.
Not in that glute area.
Pardon?
But so not in the glute area, but we went through that somatic experiencing, no? That time this palpitation, little bit, this one started. That is there.
So that is still on?
Yeah.
Okay, very good. Just sit down, close your eyes. And feel a certain strength developing in your body as you breathe in. See that you're breathing in some kind of a unique energy which is spreading throughout your body. As you breathe out, feel that whatever emotions, issues are there, they are being flushed out of your body. Once again, breathing in, you're breathing in cosmic energy. Now hold your breath. Spread this energy to each and every part of your body. And as you breathe out, flush out all pending emotions lying inside. Flush it out, flush it out, flush it out. And now, as you're sitting there, visualize or focus your energy at your heart center. And from the heart, visualize a yantra coming out in the form of a star. In the middle of that yantra, light a fire. Invoke the divine into that fire by mentally repeating to yourself, Avahanam Samarpayami. And now visualize that you're scraping the inner part of your body, and you're pulling out all sensations of palpitations, anxiety, everything that is there inside. You're pulling it all out like scraping and cleansing any part of the house. Like that, you're cleansing your whole body and taking it all out, and you're rotating it into a ball like a pinda. And you're holding that pinda in both your hands, and you're offering it into the fire that is burning in the star. And see the fire consuming it, and hear the crackling sound of the fire consuming that pinda, and see all your palpitations, anxieties, other issues burning away in that fire. And as you see them burn away, experience greater and greater relaxation of your body. One last time, go into your body, pull out, scrape out, scrape out, scrape out everything that you can get your hands on. Roll it into a pinda and offer the pinda into the divine fire. Hear the crackling sound of the fire as it consumes the pinda. See all your anxieties, palpitations, issues burning away to ashes. See the body relaxing more and more. Breathing becomes being slow, long, and deep. Now see the fire embers completely burning out, dropping away from the yantra. Pull the yantra back into your body. Take your attention to your Muladhara chakra. Visualize 4-petal lotus at the Muladhara chakra. Feel the mantra Lam written in the center. On top of that mantra Lam, visualize a nice Shivalinga. And on that Shivalinga, see a serpent with 3.5 coils resting. As you pay attention to this, see that the 4-petal lotus is enveloped inside a thick square made of yellow color. Feel yourself completely grounded to Mother Earth. Feel yourself surrendering to her, knowing that she will take care of you and you don't have to worry. Mentally chant the mantra Lam, 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 Lam. Continue to chant mentally. As you keep chanting the mantra Lam mentally, see yourself relaxing more and more and more. See a complete disappearance of all palpitations from the body. See yourself falling at the feet of your Ishta Devata, surrendering yourself completely. Now, very slowly become aware of your posture and body. Then move the head from side to side, then up and down. And then rub both your hands. When they are warm, keep them on your eyes. And now tell me whether the palpitations have eased up or they are still as
Yeah,
it is.
it's eased up, sir.
Yeah. So you know how to practice it now.
Yeah.
Every time you enter into a problem, in spite of that,
Okay.
when you're abroad,
Mhm.
if you get into any need for attention, then send me a message. Based on
Okay.
the time zone, we will try and set up so that you get some immediate help.
Okay.
Okay.
Okay,
Now
sir.
sit down in a meditative position, keep your eyes closed, and be receptive to the vibrations of the sound of Shank. Make your sankalpa. I'm chanting Om, creating protective energy field around me that keeps me protected from all external negative influences, antibodies, and viruses. Chant 3 times.
Mm, mm.
Shanti mantras. Asatoma sadgamaya, tamasoma jyotirgamaya, mrityorma mritam gamaya, sarvesham swastir bhavatu, sarvesham shantir bhavatu, sarvesham purnam bhavatu, sarvesham mangalam bhavatu, loka samasta sukhino bhavantu. ॐ त्र्यम्बकं यजामहे सुगन्धिं पुष्टिवर्धनम् उर्वारुकमिव बन्धनान् मृत्योर्मुक्षीयमामृतात् ॐ शान्ति शान्ति शान्तिः हरिः ॐ. Rub your hands nicely. When they're really warm, keep them on your eyes. Feel the warmth flowing in from the palm into the eyes. Then gently open your eyes. Slowly release your palm. Hari Om, that's it. Hari Om, that's it. Hari Om, that's it. So have a nice trip. We'll
Yeah,
get back
thank you,
when you
sir.
come back. And in case of an emergency, reach out.
Thank you, sir. Yeah,
Okay,
thank you,
yeah,
sir.
bye.
Yeah.
Do
Thank you,
well.
sir.
Bye.
Yeah, bye.